Returning now to our top story, health authorities in New South Wales have called for Australia's vaccine strategy to focus on southwest Sydney, where the virus outbreak is now a national emergency. Joining me now live is the AMA Vice President, Dr. Chris Moy. Doctor, thanks for joining us this afternoon. Do you agree with what the Premier said today, that we need to start getting more vaccines prioritised into New South Wales?
I think to some degree, yes. I think definitely increased supplies of both Pfizer and AstraZeneca. We cannot forget AstraZeneca. It's a good vaccine, and for God's sakes, if you're in the group that is qualified for it, get it, and even consider it in where it's in the not preferred category. Look, the theory is a little bit of this ring fencing theory, where you can try and get the vaccinations in, and in the area where it's most number of infections. The only issue with that is it has worked in the past with things like Ebola, but the problem is you've still got to be able to do it in a COVID-safe manner. And it's still going to take a while for the effect of that to occur. But certainly there does need to be a reprioritisation of vaccination in Sydney, and particularly the areas where they have the most transmission at the moment.
And transmission is currently occurring in parts of Greater Sydney, like the southwest, in chemists, supermarkets, food processing centres. I mean, these are places, Doctor, that just could never be shut down. So is this now a protection strategy in the state?
Well, I think, unfortunately, there is this frightening prospect that New South Wales and Sydney in particular have actually missed the boat and actually gone past the point of no return in the ability of even lockdown restrictions, where you're limited to essential movement, to suppress it and knock it out. Because unfortunately, as you've said, even the restrictions when people are allowed to go out to supermarkets when they need to go get food, there's so much COVID in particular areas that people are still catching it in those areas. So that's why the numbers are not going down, and particularly those numbers who are out in the community. So unfortunately, then you're actually in a different class in terms of decision making. Really, where you're stuck in is either, well, you need to keep in the current lockdown situation, because if you don't, then what's going to happen is you're going to have so many cases and they're going to overwhelm your hospitals and ICU departments. And the numbers in ICU and department are really going up at the moment. And the other thing then is you've just got to keep vaccinating and just hang on till you get enough people vaccinated. But it is unfortunately a prospect which has really become obvious, because I think it's become clear the decision making in New South Wales had led to this, and even in South Australia and Victoria, who just went absolutely straight away to try and slam this shut. They're just hanging on at the moment, and had they left it any longer, they'd be in the same boat.
I want to move on now. We saw overnight the Therapeutic Goods Administration has approved the Pfizer dose for those aged between 12 and 16. A number of factors to be considered. How do you think that this should, I guess, come as part of our rollout in Australia?
So really, it's definitely in line with what's happened overseas. So the approval process has happened. It's just where it fits in our rollout planning. And I think this is where, again, a group like ATAGI needs to start thinking very early about where it fits. And I suspect their minds are very much on this at the moment, sitting in the prioritisation of that group and eligibility. Do we focus still on the groups that are more vulnerable? And ultimately, it's age, particularly, but also if you have conditions, and then look at children. But the problem is Delta is across the board more infectious and may be more problematic in terms of serious illness in all age groups, including children. So there is going to have to be a bit of thinking and reevaluation, and it's been such a moving feast with the Delta, unfortunately. So the thinking may have to change, and that's very much front of mind at the moment.
Absolutely. Dr. Chris Moy, we have to leave it there. Thank you for joining me.
It's a pleasure.